go. In West Houston, Texas, born and raised on computers, where I spent most of my days. Chilling out, maxed and relaxed, all cool, and thought I'd have a job when I graduated school. But recession came. I didn't get far. I thought, is this what it's like with a degree in PR? After 23 interviews, just one was cool. They said, come and do PR and web for our schools. I liked that gig, but I did the math. There wasn't much growth in that career path, so I came to healthcare, doing PR and web and mobile and social and whatever's next. Why I stayed in healthcare ain't a mystery. Now we're changing lives and making history. A look to my kingdom, I was finally there to sit on my throne as the Prince of Digital Healthcare. Just to set the stage, this is kind of the urgency involved in what we're talking about today. The fact that your career, everyone in this room, your career will change in the next 5 years. In terms of what you do day to day. In terms of opportunities. In terms of how your organization sees you and your strengths and your value. It will change in the next 5 years. So you can either be the cause, or you can be the effect. Meaning you can either be squarely in the driver's seat, or you can be run over. It's totally up to you. I'm going to give you hopefully some ideas and some thoughts here to kind of keep you in that driver's seat. The second trend I want to focus on is that we don't communicate only in words anymore, or sentences, really. I've been trying this experiment lately of how much I can communicate without actually having a full sentence or any punctuation, and it's pretty amazing how much you can actually say that way. But yeah, I mean, sentences are so 2005, right? So we don't use that, and maybe it's just because I came from a background, from an educational and training standpoint, where I did a lot of writing. Maybe I see the value of writing a little bit more. That's just naturally I think, hey, I can address that by writing. Where we all know we are in a visual-first society now. Right? So, I mean, you can take the example of my 12-year-old daughter, right? She'll tell you that I'm emoji illiterate. And there's probably some truth to that. I mean, also, like all the smiley-faced ones, at least, they all look the same to me. They just if they're smiling, I think they're the same. And so, I'd say, hey, how was your day today? Right? So, do you know the name of this one? Okay. Yeah, nerd smiley. I didn't know that. I said, hey, how was your day today? And she's like, really, Dad? Like, did you have to call me a nerd? Exactly. I said, you know what? Look, you got glasses. She had glasses. Like, I just thought. I was like, you know what? I bet you're just hangry. We probably just need a snack. I know you like chocolate. I like chocolate. We were just running together. It all just kind of looks the same to me. So, one way or the other, we have to think visually. We have to think. Not a single word communicated here in two very different messages. What do we do about digital besides evolving it? Well, there's a couple of larger points at play here. And I want you to think about this. Most people we know, most audiences, most personas, because I don't know if any of you have a persona for an ex-millennial, but if you do, you can name it Jared. I'm good with that. And most of our personas, most of them at the end of the day are asking for somebody to help guide them through healthcare, aren't they? They're saying, I have so many questions, things keep changing. Somebody, just please help me. They're begging for somebody to guide them by the hand and say, no, really, I think I have something going on with me. How do I get it treated? How do I find a doctor who treats that, who's really good at it, who has really good bedside manner, who takes my insurance? How do I set up an appointment with that person? Where do I park when I get there? We all have so many questions, and if we think more like human beings versus a marketer or communicator, then it's sometimes easier to realize that. So my question to each of us today in this room is, will that person be you? Will it be you? Will you be the one to guide people through the changes in healthcare? That's my challenge to you today. I want to talk about a couple of ways that I think can hopefully help that. But think about that question, will that person be you? And what does that mean on a day-to-day basis? We have to address what if this goes wrong, but we can't let that be the obstacle. We can't let that stop things for us. We can't let that keep us from saying, what if things do go right? Because that was the question. That's how we pitched, in our case, periscoping a surgery, which does sound very scary. But we said, what if this goes right? In that case, it was a teenage boy who had a chest reconstruction surgery going on. So his sternum was turned inward, right? So, as you can imagine, that can make it a little harder to breathe. It can kind of mess with your heart and other organs if you're not careful as you grow up. We had a few hundred people watching that live. It wasn't thousands. And again, if we only think of impressions or reach, then we might think, hey, that's not very much, maybe that's not worth it. Well, the first 90 days, we had 12 patients who said, watching the Periscope actually influenced us to come here to get the surgery done. It was scary, we weren't even sure we wanted to get it done, but now we know a lot more about it. And the parents of the boy actually came up to us after it and said, we wish some other parents had actually done this before us. It would have helped us make our choice a little easier. That is a scary thing, have your kid, in their case, fly across the country to have the surgery done. They said, we just want to pay it forward. We're happy to, we love this. Like, we're happy to share this with other people, and we trust you guys. Okay? So, it's thinking about things just in a slightly different way. We all think about what healthcare means to us, right? Part of our career has to do with how happy we are on a day-to-day basis with what we're doing. And sometimes we need that reminder internally, intrinsically, of what is our reason for being satisfied with our job that day. Sometimes it's a little harder than others. Okay? For each of us, healthcare is personal, though. The name of the face is always different, but it's personal to each of us. There's a reason that each of us feels some fulfillment in healthcare. For me, this is what healthcare looks like. His name is Leonard. This is my father-in-law. I feel like I kind of won the in-law lottery, I'm not going to lie. I've been blessed to have a good relationship with my in-laws. This is my father-in-law. So, Leonard was one of those types of men who's truly salt. He's a salt of the earth. He would truly give you the shirt off his back. He did whatever it took. He worked as many jobs as it took to raise his family of 8 children in the mountains of northern Arizona, and lived a good life. Worked up into his late 60s. Then he retired, and he said he and his wife were actually getting ready to go out and serve a church service mission. And so, for that reason, he actually had to go to the doctor, because up until then, he never went to the doctor. And I don't know if it was a money thing, or an inconvenience thing, or just a really why would I need to go to the doctor thing, or a generational thing. I don't know why, I just know he never got his checkups. And so, when he finally had to go, instead of starting to make the travel plans, he started to make his treatment plan, because he was diagnosed with stage 4 prostate cancer. Prostate cancer, one of the most treatable forms of cancer for men, if it's caught early, which in his case it was not. It was not caught early, and so he immediately went into treatment. He was in a rural area in northern Arizona, and they went to work. They told him still that originally his prognosis was a good 10 years left. You guys don't sweat it. He has up to 10 years left. Deep down we all kind of knew better than that. He had about a year. And so as that was going on, I started looking back, and you know what? That lack of preventive care was the first failure of healthcare in Leonard's life, at least to me. But for whatever reason, he didn't go see the doctor. And this was something that supposedly could have been caught early and treated better. So as he went into his treatment, he had to eventually get transferred from about 3 to 4 hours away from Phoenix, into a new facility. And I would have thought that the care teams would be talking to each other, and quite sure they didn't. So nobody truly owned his treatment plan. And he couldn't expect his wife or anyone else in the family to own that treatment plan. Why? Because their lives just got turned upside down. So you couldn't expect them to do it, but there was nobody owning that. That was the second failure of healthcare for Leonard. It was just a total lack of care coordination. Then I think about Leonard, and I think about, seriously, there are ways that I can maybe make a difference somewhere. So when we really boil all this down, that's where our careers are headed. This is the opportunity each of us have to be an agent of change, and there's a real reason, there's a face and a name for that change. So I don't want to leave on feel like it's leaving on a downer, because Leonard's life lives on, his legacy lives on. It has inspired people to do things differently in their lives. And again, most of you probably had somebody else in mind just now as I was sharing that story. So healthcare is personal. It has a name and a face for each of us. So as we start to wrap this up, I want to kind of put a bow on this and think about, again, we've been talking about kind of a destination. It is more of a journey. I don't know if that destination is truly defined yet. What I do know is that this is the direction that we as a field are headed. But at the end of the day, it doesn't change who we are. We are absolutely still storytellers at heart. We're just doing it in a slightly different way. And truly a more effective way. We're doing it in a way that's a little bit more targeted, more transparent, and more based on technology. That's all it is. And so our ability to capture that and think about that and to internalize that and to say, hey, what within our organization can we actually take away from that? That's what our careers will be based on from this point forward. That ability to be that agent of change. I'm going to leave that challenge with you guys to be that agent of change, because truly I feel like that's where our careers are headed.